I rise today to speak in opposition to House Bill 4320. As many of my colleagues have already explained, this procedure is performed extremely rarely and only in the most dire of circumstances. And as we've heard already today, we've heard about the statistics, we've heard about the medical procedure itself, but I want to make sure I'm able to provide context for my opposition, not only in the context that my colleagues provided, but I want to share the story of a family who lives in my district. This family gave me permission to share their story because they feel very strongly that they were fortunate enough to be provided the privacy and care that they needed in what was the most difficult time in their lives, and that decisions about women's health care should be made by women and their physicians, not politicians. I'll start off by saying that this was very much a planned pregnancy. I'll say that again. This was a planned pregnancy. My constituent and her husband were thrilled that they were going to become parents for the first time, relishing in the joy of the details, large and small, like I'm sure so many of you have, like any excited new parents would in preparing for their baby's arrival. My constituent told me that she not only never missed a doctor's appointment, and she's incredibly squeamish, she will be the first to tell you that, she and her husband very much look forward to the entire pregnancy and each appointment where they learned how their baby was progressing. My constituent was healthy, and the pregnancy was healthy. On schedule, she went in for her 20-week ultrasound and an anatomy scan. And on that scan, a serious abnormality was discovered, one that would have never been detected in prior appointments. She would have never known about this until the 20th week appointment. Subsequent tests on the fetus revealed a sporadic mutation of a type of skeletal dysplasia called osteogenesis imperfecta, a skeletal condition which results in extremely brittle bones that can break easily. Excuse me. If carried to term, the baby would likely die shortly after birth or inside of my friend, my constituent. Colleagues, I really urge you to think about this outside the context of medicine. At 20 weeks into a pregnancy, the expecting parents had announced this pregnancy to their family and their friends and their coworkers. My friend, my constituent, she was showing she couldn't hide this. And so this diagnosis and the decision to have this procedure, it hit them at their most vulnerable, both physically and emotionally. Forcing women in this position to undergo even more invasive and dangerous procedures would be simply inhumane and cruel. Receiving the devastating news about their pregnancy, they took the time to reflect on the values that she and her husband both shared and ultimately came to the decision to terminate the pregnancy. My constituent and her husband felt deeply that this was their first act of love and mercy as parents. These parents so wanted this baby. They wanted him or her to be healthy and live a life that was full and without suffering. And this diagnosis simply made that impossible. Once she and her husband made this decision, she had to find a doctor who was willing to perform the procedure, as many do not. When she found a hospital that would, the maternal female medicine specialist at the University of Michigan Women's Hospital, her physician met with her for hours, and it takes multiple days to perform this procedure precisely so that women are able to make fully informed choices. The physician insisted that she, and not her husband, answer questions and explain her situation to ensure that she was not under any duress. The physician ran her own scans and tests and confirmed the news that my constituent and her husband had received from other physicians. Following the procedure, their physician informed them the condition of the fetus was actually much worse than revealed in the scans. There were multiple fractures in the skull, and this condition was likely to have gotten much worse as the pregnancy went on. This decision was not made lightly by my constituents or their doctors. She asked me that I express to all of you in telling this story that I specifically emphasize that the doctors and my constituent and her husband were not hasty in their decision-making or uninformed about what would happen. It was likely the hardest decision my constituent and her husband have ever had to make. Undergoing a different procedure would have opened up the possibility that this couple wouldn't be able to ever conceive ever again. Subsequently, my constituent and her husband were able to have the family that they so wanted. They have 2 healthy girls whose energy lights up every room they enter. Colleagues, while I've referred to this family as my constituents throughout this speech, I want you to all know why I'm so emotional about this story. I've gotten to know both of them very well, and their extended family had outside of politics, and I've celebrated Hanukkah and birthdays with them at their home, with their families and friends. They've welcomed me into their home as one of their own. This is the kind of family I'm talking about. They are not only loving parents who were forced into a heartbreaking situation and had to make a very difficult choice. They are active community members who continue to selflessly share one of the saddest moments in their lives with the hope that this story will shed light on the reality of this matter, which is that they view themselves as having the privilege of a support system and received the top medical care that resulted in the best medical outcome for this pregnancy and the mother. They understand that many women and families, like so many of my colleagues have outlined, face major challenges with regard to access to care, and feel strongly that government intrusion, including having to register on michigan.gov that they were having this procedure, leaves families feeling exposed, judged, and vulnerable during an intensely sad time in their lives. I ask that this legislative body respect the Constitution and leave this medical choice to families, women, and their doctors. It is an intensely personal and difficult decision made only under the most dire of circumstances. Banning this procedure will not result in fewer abortions being performed. It will only force women to undergo other, much more dangerous procedures that at the very least risk the future fertility of the mother, but could also endanger her life. I urge you all to vote no on House Bill 4320 to protect the constitutional right of women to make their own health care decisions. Thank you, Mr. Speaker.